today on the Healthy Living Grants Initiative Request for Proposal. Thanks so much for joining us. If you're considering submitting an application and you're wanting to gain a greater understanding of what's required, you've come to the right place. My name is Shawn Brown, and I'm a program officer with the Kansas Health Foundation. And joining me today are my colleagues, Senior Program Officer Carolyn Williams and Associate Grants Officer Blair Weaver. Carolyn has a long time history with the Foundation and a broad range of experience developing and managing program initiatives, and is the program officer responsible for this initiative. She'll be providing an overview of the RFP, followed by Blair, who will walk you through the online application. And then we'll follow up with Q&A at the end. This webinar is going to be jam-packed, and at the conclusion, it's our hope you'll have some key takeaways to help you with your proposal submission. So with that, let's get started, and I will turn it over to Carolyn.
Thank you, Shawn. We wanted to share some information with you about the Healthy Living Grant, RFP, to let you know the purpose and the process that we will be going through with this RFP. First of all, the purpose is to fund organizations, up to 10 nonprofits and government organizations, to focus on improving health outcomes for at-risk populations through efforts designed to increase access to healthy foods, increase physical activity, reduce tobacco use, and increase access to care. This 2 years funding for organizations is designed to implement evidence-based strategies recommended by the CDC, Institute of Medicine, and other leading health organizations that align with 4 of Kansas Health Foundation's health equity impact areas. As previously stated, the access to care, physical activity, healthy food access, and tobacco use. Funding only those organizations with existing capacity to make progress and that have demonstrated success and experience to focus on improving health outcomes for at-risk populations. To be considered for funding, the applicants must demonstrate that their proposed activities are implementation ready and evidence-based. While there are a wide range of potential evidence-based strategies that support healthy living, KHF recognizes personal changes are made in the context of a larger environment and that many health problems are related to conditions outside individuals' control. As a result, KHF is particularly interested in funding strategies that lead to implementation of policy, systems, and environmental interventions that support increased healthy food access, physical activity, access to health care, and decreased tobacco use. When we say policy strategies, we're including things like laws, ordinances, resolutions, regulation, or written rules. For example, an organizational policy change that provides time off during work hours for physical activity, or ensuring healthy food and beverage items are available in worksite cafeterias would be a policy strategy. System strategies impact possible choices and behaviors across an organization, institution, or system. For example, changes to the school system to support physical activity throughout the day, and changes to health systems, clinics, etc., to ensure each tobacco-using patient is given evidence-based support during the time that they are at that clinic or at a hospital setting, would be examples of system strategies. And environmental strategies include physical or material changes to the economic, social, or physical environment. For example, incorporating sidewalks, paths, and recreation areas into community design. But I do want to point out that any funding requested for programs for individual behavior change or community design construction must clearly be connected to PSE interventions. You couldn't just ask for construction of a sidewalk. There would have to be policy, systems, and environmental changes as part of the design process. and who may apply. Foundation anticipates receiving proposals from a wide range of organizations. Grants are not limited to community-based efforts. Organizations representing different perspectives of population groups that are disproportionately affected by obesity, tobacco use, and those addressing lack of access to health care may apply. Healthcare providers and systems, as we talked about earlier, clinics or hospitals that want to make changes in their policies within their system would be eligible. Local and state governments that wants to make policy changes, for instance, want a community design to support their efforts in changing policies within the local or state government. Academic institutions and housing authorities as well. An example from a housing authority might be wanting to eliminate tobacco use on grounds of a housing authority, which would be a PSE effort, would be eligible to apply. The available funding for this is a maximum $100,000 per award for a 2-year grant. Of course, applicants may request less than $100,000 and for a shorter grant period as well. We anticipate awarding up to $1 million through this RFP and anticipate there would be up to 10 organizations that would receive the funding. Those who receive funding would have quarterly updates, either calls or in-person exchanges with the foundation, providing feedback throughout the grant term. We also plan to convene the grantees twice during this process, one shortly after awards are announced, and then another about midway through the process, so that people can learn from one another, and we can also have lessons learned through this process as we go along. Preference will be given to proposals that clearly demonstrate one or more of the following, as you can see on the slide. We're funding only those organizations with existing capacity to make progress and have demonstrated success and experience to focus on improving health outcomes for at-risk populations. And we're particularly focused on strategies that will improve the health of low-income Kansans and other populations affected by obesity, tobacco-related chronic disease, or do not have adequate access to quality health care. We also have a clause in our RFP regarding conflicts of interest, and the foundation wants to avoid any real or perceived conflicts, so the foundation reserves the right to not fund organizations that have contracts with or receive funding from a tobacco company or soft drink manufacturer. Applicants must sign a statement describing what those relationships are with either tobacco companies or soft drink manufacturers, and the foundation will review that at the time and determine whether or not a conflict of interest exists, whether or not we can fund a particular proposal. We also have some grant exclusions as part of this. First of all, lobbying. There would be no lobbying supported through this, but advocacy can certainly be supported through this grant process. And as noted earlier, programs for individual behavior change, unless they're tied to a specific PSC intervention, or community design construction, again, unless it's tied to a specific PSC construction, cannot be funded. Also, the foundation does not fund direct health care services. As you can see from this slide, we will be scoring different sections of the proposal. I won't run through each of those, but you can see the page limits if we have them, and the scoring that reviewers will assign to each section of the proposal. And the timeline, as you know, is already released, and if you're listening to this, the webinar is already on the website, but the proposals will be due by 5 p.m. on June 29th. The foundation will review those and grant awards will be announced sometime during the week of August 15th. We don't have an exact date for that yet, but you can watch our website for those announcements, and emails will be sent to each of the applicants. The grant term begins October 1, and as you can see, we'll have progress and financial status reports that are due annually by November 1 of each year following. But as mentioned earlier, we will also have quarterly check-ins with each of the grantees, either by phone or in person. And the grant term ends no later than September 30th, 2019. Of course, they can end sooner than that if your project is for a shorter term. And then your final grant progress and financial status report will be due 30 days after your project ends, whatever date that might be. And now Blair Weibert will walk through the application process.
Thank you, Carolyn. As Sean had mentioned earlier, I am the Associate Grants Officer here at the Foundation. What I'll be doing today is walking you through the application process as well as our website for the Healthy Living Grants Initiative. So you can start by going to the initiative page, which is actually found on our through our homepage. So if you go to kansashealth.org, as you see up here, you can go up there, scroll down, and then you will see a green box on the left-hand side of the page for the Healthy Living Grants Initiative, and you just click the Learn More link, and that'll take you right to the landing page. So at the beginning, we just kind of have a short overview of the initiative itself, what we are looking to accomplish, and such and so forth. If you scroll down a little further, we will have the webinar posted here later today, or in a couple days. And then the request for proposal document is found here. So if you click on that link, it'll bring it up, and that'll go over the RFP itself, as well as instructions for filling out your proposal narrative as part of your application. That will be a separate Word document that you will upload yourself. And as I mentioned, all of that will be detailed in the document itself, which can be found here. If you scroll down a little further, we have our proposal instructions and templates for attachment. So as you can see here, we have it in bold, and as Carolyn had noted earlier, the due date for your proposals is on Thursday, June 29th by 5 p.m. That is a very hard deadline, so if you do not submit a proposal by 5 p.m. on June 29th, everything of the online proposal will be taken offline, and you will no longer be able to start an application for submission. So please make sure that you get your applications in before this date and time right here. In this section, we have all of the templates that we will be asking you to fill out and submit with your proposal, with your online proposal. So the first one we have is the budget and justification template, which is the project cost that you will be requesting from us. As Carolyn said, it's up to $100,000. So that is what you will detail in this template. Below that, we have the overall proposal and revenue table, which is not required. It is only required if you are receiving additional funding to complete your project. So if you are only asking for funds from the foundation, you will not need to complete this table right here. But if you're receiving outside funding, then you will need to complete it and upload it with your proposal. And below that, we have our proposal objectives template, which is where you will craft your objectives for the project itself. Below that, we have our acknowledgement of agreement review. Now, in this form, what that states is that you will be reviewing the grant agreement template, which you can see right here. You'll pull that up, look through the agreement template itself, look through the terms, and make sure that your organization is able to abide by those terms if you are to receive funding. So pull up the template here, read through it, And as long as you are okay with our terms, you will sign this form right here and then submit it with your proposal. Below that, we have the financial relationship statement. As Carolyn had also noted, it is for our purposes to review and make sure that there is no conflict of interest between your organization and any soft drink manufacturers or tobacco companies. So this is that statement that Carolyn had mentioned earlier, where you will say any relationship you have with those types of companies, sign it, and then upload it with your proposal. Below that, we have this link here. It's just a useful resource tool for when you are filling out your objectives template. It helps kind of gives you a guideline of the kind of objectives that we're looking for. We're looking for SMART objectives, so we want them to be very specific. And if you have any questions, then this page right here is where you would click. And any other questions, you can reach out to us after reviewing this template on what we are looking for. So scrolling down even further is where we have our FAQ document. So any questions after reviewing the RFP, you can go here, click here, and read through questions that have been submitted to us and see if those would answer any questions you might have. And then at the very bottom of the page is where we have the link to start your online application, as well as some contact information for Carolyn. And then we also have Gina Hess, who she's our grants associate, and she can address any questions that you may have for the application process itself. But right now what I'll do is I'll click on the link. So like I said, once you get all of your templates in order and you have your proposal narrative created, you can click on this link here or this link here. They'll both take you to the online application itself. So this is the page it'll take you to. If you have created or submitted any other applications from previous initiatives that we've done, and so you have an account with us already, you can just sign right in with your email and password. If you're a new applicant, you would click here, and then you would fill out the information here to start an account with us. If you are with an organization where someone has created an account that you don't know, but they no longer work for your organization and you don't know their email and password, you will have to create a new account. Unfortunately, we are not able to retrieve any passwords or reset any passwords for the application process. So you would have to start a new account for your organization. And like I said, you can do that here by clicking on the new applicant link. And then if you have started your online application, you are able to save it and then come back to it. All of your information will be saved within the proposal before submitting it. So that is an option. You don't have to do it all at once, which is really nice. Basically, once you click in here and you sign in, you'll just fill out a basic cover page with information about your organization, such as your address, telephone number, and then we will have you indicate on that cover page your primary contact for your organization. So someone within your organization who has the ability to sign off on important documents, they would be considered the primary contact. And then we will also have you list a project director, who is the person who will kind of be the liaison with your organization regarding this specific project. And with that, we'll just have you fill out those two people within your organization, and as well as just their basic contact information, and then some basic information about the project itself, such as what the name of your project, kind of a brief description of it, and how much you're applying for, and such and so forth. And then from there, we will just ask you to upload the templates and your proposal narrative, and then you'll be able to review everything and click submit. Once you submit, you should be receiving an email stating that we did receive your application. So if you don't receive that email, feel free to reach out to Gina Hess, who was on the at the bottom of the landing page that we had indicated. Her phone number and email is on there as well. So that's basically kind of an overview of the application process as well as the website. And with that, I think we are going to hand it back over to Sean, who's going to go over some questions that we have already received. So Sean, whenever you're ready.
Great, thanks, Blair. Here are some questions we've received. We're planning to submit a proposal for the Impact and Capacity Grant Initiative this year. If we are awarded a grant, will that eliminate us from being eligible for the Healthy Living Grants RFP?
No, that will not eliminate you from being eligible to apply for a Healthy Living Grant. As long as your organization meets the eligibility requirements listed in the current RFP, you may apply for a Healthy Living Grant. I recently had a little more detailed question from a previous grantee asking that if they would be eligible to submit the project that they had funded previously, but they'd made some changes in that project, if that would be eligible. And I assured her that it would be, and said I thought it would be important for her to explain why they implemented some of those changes. I'm assuming it's from lessons learned throughout the process, and explain how they think that will make for a more effective project.
Okay. Can a Kansas Pride program submit a Healthy Living Grant proposal if it's not a 501c3 organization?
No, sorry. Organizations must partner with eligible organizations that have a 501c3 status. So work with your community partners and develop a collaborative to prepare a proposal to submit to us.
In the grantee exclusions, can you talk more about the community design construction exclusion?
The foundation recognizes that community design efforts are important for promoting physical activity, but we won't award a Healthy Living grant that are limited to just construction. Any proposed community design construction efforts must be related to a broader policy system and environmental intervention. As I briefly mentioned earlier in my comments, if the community design is part of the effort of moving a policy or systems environmental change forward, then that might be considered. If it's just for the purpose of implementing those policies, for instance, where the new trails are going to go, etc., after policy has been adopted, then that would not be eligible.
I heard you mention policy development several times. Can you expand on your expectations for systems or environmental changes?
Well, I think you can find the expectations on page 2 of the RFP. But systems or environmental change are often results from an adoption of a policy, and I mentioned those a little earlier in my comments. But review page 2 of the RFP. I think that might answer some of your questions.
Can foundation staff give me feedback on my proposal idea or tell me what would be helpful to include in my proposal to increase my chances of receiving funding?
No, we can't give any specific feedback on your proposal other than to say that make sure you provide all the information clearly so that we can understand what you're planning to do with your project, that your objectives are clear with the expectations and the dates by when you expect to have met those objectives. I guess the only advice I can give is just make sure someone who knows absolutely nothing about your project can fully understand the project from reading your proposal.
Is there a required annual meeting for awarded grantees?
Yes, there will be 2 required in-person meetings in Wichita, and we will ask you to include that in your budget as you're developing your proposal. For those who do not work in Wichita and will have to drive in and perhaps stay in a hotel overnight, that needs to be part of your budget proposal. But our first meeting is going to be shortly after the awards are announced. We plan to meet on Monday, October 30th, 2017, from 10 a.m. to 4 p.m. We're hoping the 10 a.m. start time will give people who have a little further to drive an opportunity to come in that morning so that you won't have to travel on Sunday. And then the last meeting that we have scheduled is Friday, November 16th, 2018, from 8:30 to 4 p.m., again in Wichita. That will be about a year into the project, And we're hoping that for those who only have a 1-year project, they will be able to join in that. For those who have a 2-year project, that will be midway point for you. And we're hoping that these meetings will help you not only with connecting with other people doing similar work around the state, but also share what you're learning as part of this process.
Could you provide information about a previous winner of this funding as an example?
Yes, grantees in the first round of the Healthy Living Grant Initiative worked to support advocacy and community organizing in their community toward 3 major outcomes. And that was focused on increasing access to healthy foods, expanding opportunities for active living, and improving the built environment for active transportation. Some developed a model policy that can be locally tailored to prevent the use of e-cigarettes in public places and work sites. Another was implementing system strategies to increase the healthy choices of fruits and vegetables and other healthy food items in their community. As you likely noticed, did not say anything about increasing access to care, access to health care. That was not part of the original, the first RFP, but that is included in this second RFP.
Is this funding primarily for county, city, and state policy changes?
Well, yes, but also for organizational changes as well. Organizations can make those changes within their system. An example was given earlier about allowing employees a few minutes in each day to be physically active, or ensuring that healthy foods and beverages are available throughout the day, as well as for policies, laws, ordinances that city, county, or states might enact as well.
Great. And our last question, can a small nonprofit that creates internal policy change apply and be considered?
Yes, there's no size restriction on this. And I think that's the last of the questions that we have at this point. We want to thank you for listening to the webinar today. Hopefully, by reading through our initiative landing page and the FAQs, that it will answer the questions that you have. If you have questions, if you have difficulty with uploading any of your documents, of course, contact Gina Hess for any assistance with that as well. Thank you for joining us.